Dr. Natalie Azar and NBC's Sarah Daloff in Dallas, thank you so much for being with me this morning. Appreciate it. And let's go now to the Washington aspect of this and what has turned into a political debate around the president's response to the crisis, more specifically around the man the president chose to lead that response, Ron Klain. Seen here with the president in 2009, some criticizing that pick, including Republican Texas Senator Ted Cruz.
We should be less concerned about giving the public the feeling that the government is on top of this and more concerned about the government actually being on top of it. And this is a manifestation. We don't need another White House political operative, which is what Mr. Klain has been. What we need is presidential leadership.
And joining me is someone else who has been critical of the president's pick, Tennessee Congressman Marsha Blackburn. Congressman, thank you so much for being with me.
Good to be with you. Thank you, Jose.
You said yesterday we want facts, not spin, when it comes to the new czar. What did you mean by that?
Well, what we need is someone who understands all the aspects of government and understands the delivery of health care in this affected region. And having someone with a broader experience in health care and emergency response would be more appropriate, I think, than someone like Ron Klain, who is known for being a spinmeister. And the American people are just so frustrated. They want someone who is the adult in charge, who can say, this is exactly what we're dealing with, this is the transmissibility of the disease, this is how we should go about it, and they feel as if what they've seen from this administration is indeed a crisis in confidence and a lack of ability to appropriately respond.
Now, the Congressman, you know, the fact is that that's why you have the NIH and that's why you have the CDC to deal with the medical aspect of it. But doesn't there need to be someone who knows bureaucracy so he can cut through it? And it seems as though maybe, I'm just asking, it's someone who knows how government works and where the backlogs are to go through that is maybe more important than the medical expert that already exists in the administration and the country.
Well, you just brought up an important difference. Knows government and governmental systems and not the political aspect. And that's the difference, and I think an important one right there. How you go about coordinating the delivery of these systems. Someone like General Honore, who had helped with Katrina. There are others that have been recommended that have that breadth and depth of experience working within that system. I had mentioned former Senator Bill Frist, the former Senate Majority Leader, who's a physician who had effectively run the Senate and who also has delivered mission health care in this region of the world. Someone like that would bring a view that would be more respectable to this situation.